Briar was born July 25th, and he has a diagnosis called total intestinal ganglionosis. He basically is lacking nerve cells in his complete small and large intestines.
Well, you only need the light when it's burning low.
Darian was born premature, and we were in the hospital for a while, and he developed necrotizing enterocolitis. Pretty much his small intestines died and had to be removed, all but 5 centimeters. They told us he might not make it plenty of times.
Only know you've been high when you're feeling low.
My son was born, everything was good. Maybe 10 days after, he got some high temperature, so we go back to the hospital and they said that he have an immune system problem.
As soon as we got home, I realized I am bringing home a yellow baby. And I knew if I didn't do something now, like, he wasn't gonna make it. So we got on the computer and we found UCLA.
Google. I ran to Google to see where we could find places that were having the study.
And I sent an email to Dr. Calkins, and within an hour of sending that email, she got right back to us.
She actually contacted our research team and asked if there was something we could do, if there was another option for Briar.
Briar! You're supposed to be like happy and bubbly and jumping up and down.
Some children are unable to eat by mouth in order to sustain them. And so in order to nourish them, to grow and develop, they need something called IV nutrition.
He gets all of his nutrition in a line that's actually threaded into his heart.
Briar became dependent upon IV nutrition. So without it, he would have succumbed to dehydration and malnutrition. So that was his lifeline. But unfortunately, because of the IV nutrition, he faced unfortunate consequences. And one of those consequences is intestinal failure-associated liver disease. Over the past couple of years, many people have been interested in trying to figure out what in the IV nutrition damages the liver. Traditionally, when children receive IV nutrition, they receive soybean oil. About 5 years ago, we were able to gain approval to use fish oil. Soybean oil was replaced entirely with fish oil. And what we've seen is that in over 75% of these children, we were able to reverse it.
This child does not have a normal immune system. Common things that children can easily fight off would take the life of this child. They actually take bone marrow, and with that bone marrow, correct the missing gene, and then give it back to the patient.
That's probably what it's convinced me, because I said, oh, it's gonna be his own cells.
Just this week, we were in the operating room collecting bone marrow from this little 5-month-old baby, and in Dr. Cohn's lab, they inserted the missing gene back into the baby's DNA, and then yesterday afternoon, it was infused back into the boy.
Thumbs up.
Written in these walls are the stories that I can't explain.
One of the most important things at Mattel Children's Hospital is when we see patients, we see them as children, not as diseases.
And it's very important that the physicians or the scientists working in the laboratory speak to the physicians or scientists working with patients. And that connection is incredibly important.
Mattel Children's Hospital is right in the middle of a 3-block radius of world-famous institutions. So it promotes discussion and interaction between scientists and clinicians at the hospital to solve problems together. For years, science was a person sitting in their laboratory trying to answer a question. Now we know the best way to approach things is actually with group science.
As a neonatologist, at any time of the day, I can pick up the phone and speak to an expert in a specific disease. And that's not necessarily always available at other hospitals.
The Children's Discovery and Innovation Institute bringing pediatricians and basic scientists together.
Physicians, like myself, really believe we need to search for better answers. We need to try to prevent this disease, first and foremost, and then if it does happen, how to better treat this disease so we can provide children with the best results.
He is such a happy baby. He loves life, and he's not yellow.
This is the best place that helped us get anywhere. So being here gave us peace of mind.
I just look at him and I just love those white eyes, you know, because when we brought him home, we didn't have that. And that's kind of a sign to us that we know he's doing good.
Well, you can
In Montreal, they say that we have some chance that it's not gonna give him help. So when I came here, they said you have like 90% chance. So I was like, go to LA now.
I would definitely tell anyone to come to UCLA. They gave us peace of mind. They helped us understand his condition and what we could do to help him. And they were very helpful as far as getting him to where he is now. Very supportive.
Without UCLA, I don't even want to know where we would be. Honestly, I don't think he would be making it, honestly. I can't think about a life without UCLA.
I'm the man, I'm the man.